Good morning, nurses. So I wanted to talk about ventriculostomies and neurocare for the patient who has had a brain injury, post-craniotomy with a tumor removal or brain bleed. So sometimes the patient needs their ventricles drained because of high intracranial pressure. And so the doctor will put in an EVD, or an external ventricular device, also called an ICP, or a ventriculostomy. So that goes in the brain. They'll shave the head. They'll insert a catheter inside the brain. It's kind of looks like a plastic, like just a little tube that goes in there, and then there's a drain that comes off, and it attaches to a device with a cylinder and a 0 point, and then there's a ruler that has like millimeters of mercury on it or centimeters of water. Very important that you know how the doctor wants to measure. So they can either order it open to drain, in which case you need to know where to level it at. So like 10 millimeters of mercury open to drain, you'd set the ruler at 10 and put the canister there with the arrow pointing to it, telling you that anytime that the ICP goes over 10, it will drain CSF. Or it could be open every hour and drain 10 mLs. In which case every hour you would go and you would turn your stopcock and let it drain 10 mLs, or when it stops, if there's not 10 mLs in there. Or it could just be to monitor, in which case your transducer your stopcock would be off to the drainage bag. So that's those are some ways that it could be ordered, and as far as draining is concerned. Your ICP, you want it to be less than 15, and a lot of times your systolic blood pressure is ordered to be around 140, sometimes a little higher, sometimes a little lower, but very important to know what your parameters are from your neurosurgeon. You need enough blood pressure to pump the blood up and get it past the pressure in the brain, and think about the blood has to go uphill in order to get up there. So you have to have enough blood pressure to do that, but you also don't want too much blood pressure because you already have a problem in your brain and you don't want to pop anything from a blood pressure that's really high. If your ICP is elevated, you can of course drain. You want to keep a neutral neck because this is the only pathway to get the blood into the brain and to let the blood drain out of the brain as well. So very important that your neck is neutral. Sometimes they'll put a C-collar on just to keep the neck in the right place. Important to know why your C-collar is on. Is it because of the neutral neck, or is it because they've broken their spine, in which case you can't take it off to clean or anything. So neutral neck, and you want the head of the bed at least 30 degrees. You want good oxygenation, whether that's through a ventilator or just an oxygen mask, nasal cannula, open airway, those kinds of things. But you got to make sure the patient is oxygenating well. You want your CO2 on the lower end, so the doctor sometimes will write keep the CO2 less than 35 because CO2 vasodilates, and you don't want vasodilation because that'll increase the pressure in the brain. You also want them to be pain-free as much as possible, so you might need to give them some pain medication. A little bit of sedation is okay, but you have to be careful. You want to be able to assess their neurostatus. And if they're too sedated, then you won't know if there's been a change in their neurostatus. Let's see, you also need seizure precautions. So darkened room, limited visitors, the TV probably off, padded side rails, and probably some seizure medication for preventative measures. You also can give something to decrease inflammation in the brain, like a Decadron, dexamethasone steroid, or something to reduce cerebral edema, which would be a mannitol. You want their osmo high and dry, so usually you want their osmo in the high 300s. And those are just some ways of maintaining the ICP and then draining. And stay tuned for a video with the actual setup and a demonstration of how you set that up. The 0 point on your transducer should be at the tragus of the ear, because that's going to be in line with your ventricles in the brain. So stay tuned for that, and join me on YouTube, and make sure that you like, share, and subscribe, and I'll see you on the next one.